for persuasive purposes. That's how we work with that. Does that answer your question? Then the first two questions related to working, I think, yes, you used an example, somebody over here earlier, in regard to reproductive rights, and I think it applies to all different areas, including gender-based violence and stuff, that women's organizations are focusing on women mainly from the victim or survivor empowerment perspective. I think that's what we tend to be doing. With legal work, because that's the best thing I can talk about, I don't know too much about the other areas. Because we see these gaps in the law, through strategic litigation, number one, you either redefine rights or enforce rights, or you attack a policy, practice, or conduct that is unconstitutional or violates a human right of any kind. So, from that perspective, it is best to work with it from the woman's perspective and obviously litigate a case on behalf of a woman or a class or group action on behalf of a group of people who are suffering a similar injustice. So, legally, there's not really a space right now to do that. But I think that through training, and this is something I have been discussing at work, and I'm going to take it back now, we need to do some more training with men around, for example, sexual harassment, sexual violence, and all of those things. But you're right, that cannot be used separately. We cannot just have men's organizations working with men only. So,
Sure. We have a few more minutes for comments, so everyone else comments.
Okay, I'm not speaking at the academic level, I'm speaking at the community level. In Namibia, we've got wonderful policies and laws, but are they being implemented? That's another question. We don't see any implementation at all. And engaging with women only, I really don't understand your question, because when HIV came on board, we took the first step as women living with HIV. We wanted to involve our men to come on board, but it was a huge challenge. We could not get men to come on board. So we are still extending our hand as issues are going on. We are extending our hand to say, let's work together. We are not working in isolation only as women. We took the first step, but we are still extending and saying, let's come and work together. We are mothers at the same time. And funding shift, how have you addressed the challenge? As Namibian Women's Health Network, we've been working without any funds. Maybe that is our biggest challenge, because we are passionate about what we do. We are passionate about working together. We are passionate about HIV. We are passionate about our children when it comes to PMTCT. Money is a secondary. How can we use positive culture in balancing? Because currently we are doing community dialogues where we are meeting men by themselves, women by themselves, traditional leaders by themselves, and then come together. We don't want to impose. We want them to look and see what are the harmful cultural practices, and then for them to say that maybe these harmful cultural practices should be dealt with, but the positive cultural practices should be put on board to support whatever is being done. I think that's all I wanted to say.
I want to refer to the question of the future vision and what do we see happening in future. For my organization, we definitely want to, we'll never stop working with women, we can't do that, but we want to extend our work with men. And through strong relationships with male organizations. In terms of the implementation, what we have a campaign here called the Sugar Visa campaign, and many of our organizations belong to that. Women and men organizations belong to it. And we study, these international documents, and then we challenge government. We write letters, we do presentations to portfolio committees in Parliament, we run shadow reports. So those are all techniques of challenging government in terms of implementing those treaties and things. And then in terms of funding, I don't really see a problem because women's organizations can access funding for male programs if they have them in their organizations, or they can do joint fundraising with male organizations and access funding through that.
I just want to make a comment. Of course, from the very beginning, these boys are our sons, and we really reached out our hand to ask our sons to talk about HIV. We're not only talking to women. But the problem that occurred is that most times, at the very beginning when HIV/AIDS came out, is that most of the times it was women who were coming to meet together. But you would never talk to one sex only. And you cannot say we should talk to the not converted ones. I think it's wrong to decide to talk to one sex. We should talk to both of them. Man and woman live together, and I think it's a family. And what we believe in right from the beginning, I believe of family-centered and family-based approach. So I cannot say I have to bring out only to talk to the converted. I think we need to bring in that balance, that in a home, there's a child, there are children, a boy and a girl, there's a father and a mother. And I think we need to bring it up in that whole aspect of family-centered care, so that we talk to them both. Even the ones who are converted, but working together, men and women and boys and girls. The concerning culture, nobody has even said a moment that culture is bad. In fact, there's a lot of positive issues in culture. The thing is that who's going to change this culture? People believe in the cultural leaders. People believe in culture. All we need to do is let's sit together with these cultural leaders and talk about HIV/AIDS and say, this is how this disease progresses, this is how this disease runs, these are the social dynamics of the disease, and let the cultural leaders and people themselves actually think that this is called the right culture, this is a bad culture. We all believe in culture. Funders, I think funders respond to what the needs of the country and needs of usually we write country proposals, we write organizational proposals, and it's up to us to say, yes, in funding now, we really see there's a gap, and we're supposed to do a gap analysis and say, there's a gap. We need male involvement and men's programs. So I don't think a funder can look at that gap being shown to them. We need funding for this, and this is a future, and refuse to give funding. So I think the way that we've come up with our proposals, whether it's the Global Fund, whether it's PEPFAR, whether it's whatever funding you are getting, really is the way we're going to go about it. We know the gap, it's a problem, and we want to have more men engagement, so let's do that. Let's put that in our proposals. Thank you.
So thank you everyone, and on behalf of the Athena Network, our members, our partners, Sonke, MenEngage, it has been an absolute privilege to have this conversation, to map out some of the complexity of the political terrain, where are the tensions, where are the opportunities, have some concrete examples of where the rubber hits the road, and moving forward in conversation together. So thank you. Let's continue this afternoon, continue this week, and on. Thank you.
Participating at the 16 days at the World AIDS Day, talking about
across Namibia.
No, we are starting with because we don't have.
Yeah.
We are starting with mix.
Okay.
So we've identified 10 young men.
Yeah.
Who's going to take this, and they are leaders in the arts business, small and medium business.
Yeah.
And coming together, starting to talk about issues, but we want first to educate them on so many different issues.
Right.
What also is coming from us as women.
Yeah.
So how can they support us? How can they send these messages when it comes to gender-based violence?
Well, we see how we can connect them to the MenEngage network.
Exactly. So I'm going to get in touch with him and say, please, let's work together. We started something already.
What about the White Ribbon campaign in Namibia? Are they doing much?
You know, the challenge in Namibia is that we work in isolation. Okay. We don't know what this one is doing. Instead of coming together and supporting each other.
Is it regional issues? I mean, is it in terms of the distance between the cities, or is it more just people not working together?
Yeah, I think it's also, you know, when you look at the apartheid system, the creation of divisions was so huge. Exactly. Yeah, but I'm still hammering Nanaso to say, please, we must have a conference for civil society organization. We need to come together. We need to talk about how do we work together, how do we complement each other.
Yeah.
You see?
And not just pigeonhole the conflict work. I think the other part that I'm quite keen on is to say, let's integrate it with non-post-conflict settings as well.
Because eventually in the conflict,
right.
you have you know how to deal with it. Like what's happening.
Right. Yeah. So I'm going to go to the conflict one and I may jump over, but it's not for lack of interest.
Okay, that's good to know.
How many places I can be in at a time.
That's good to know.
So I do, but I think there's some really cool ideas too.
Yes, there are.